mental disharmony, socio-economic disadvantages. In moderate to severe mental retardation, emphasis will be more on the brain pathology and brain damage, which lead to loss of specific function or skill, active disruption of normal brain activity, increased risk of epilepsy. Self-learning difficulties also contribute in causation in this category. Adverse temperamental characteristic, impulsivity, overactivity, distractibility, psychosocial consequences of the handicap, child's social isolation, low self-esteem, parents' overprotection or, to the contrary, rejection, sometimes iatrogenic causes, side effect of drugs, anti-epileptic in case of epilepsy associated with mental retardation, over or under stimulating environment within an institution. Specific diagnostic category, as I mentioned, the most important things, that is we'll start, for example, with autism, which is under the category in child psychiatry that's pervasive developmental disorder, the most important, infantile autism. At least 75% of persons with autistic disorder are also mentally retarded, and their IQ below 70%.
The association common between autism and mental retardation.
The mechanism is unclear, but it is possible that, at least in some cases, both may be related to common biological factor. For example, congenital rubella can lead to both, tuberous sclerosis, fragile X syndrome, infantile spasm, subacute sclerosing panencephalitis. In these conditions, the situation will be due to organic pathology, which causing mental retardation at the same time autism.
بس عشان يبقوا الجماعة الجداد عارفين what is meant by autism، يعني شهادة autism. ده سندروم فيه 3 حاجات مهمين، يعني اللي هو يبقى child عنده defect في السوشياليزيشن وديفكت في اللانجوج وعنده موتور stereotyped behavior. 3 features دول characteristic للchild with autism كسندروم، يعني الهول سندروم. لكن هنا اوتيستيك ممكن تحصل كسيمتومز، يعني اوتيستيك سيمتومز childhood، يعني واحدة تحصل من 3، مش شرط السندروم كله يبان.
And the important issue here in differential diagnosis of autistic disorder from mental retardation, pure, is it purely mental retarded or purely autistic disorder or combined together? There are some important points in this regard. First of all, deficit in social behavior. In case of autistic disorder, there is poor eye contact, the child not seeking comfort from another person when he is in distress, and there is inability to recognize others' feeling and to develop friendship. In contrast to mental retardation, which is, in that case, there is no such problem in social interaction and social behavior. Another point is that abnormal language development. It might be delayed language acquisition in both categories, but here in the autistic disorder, there is abnormal prosody, unusual use of personal pronouns, echolalia, inability to communicate through gesturing, pointing, and facial expression. The third thing is that in the play, the way they play, the children, it is different from mentally retarded and autistic children. In autistic children, they use toys for sensory stimulation and not for their intended use. For example, if there is a car and there is a wheel. So mentally retarded, simply, if he, in spite of that he is slow, he can use the car just to play that he is riding the car. But in autistic, he will take the wheel and just running the wheels continuously for sake of stimulation rather than for intended use of that play or toy.
Excuse me, I need once to explore that the autistic child will be interested in the spiral playing.
Yes.
حاجة تعمل rotation, spirals, يعني movement.
ده الاوتيستيك.
ايش الراشونال يعني just like
Stimulation. Self stimulation.
هتيجي بعدين في الستيريوتايب موفمنتس.
Attention deficit hyperactivity disorder. Mental retardation is a predisposing factor for ADHD. It is inappropriate to diagnose attention deficit hyperactivity disorder in retarded person unless the symptoms are excessive for the child mental age. In most cases, it occurs in some situation, so it is just symptoms, not the whole spectrum of
هو دي اللي
disorder.
احنا عايزين نقولها.
Yes.
يعني اول اعرفهم بالسندروم، يعني هو ده طبعا هايبر كينيت سندروم. السندروم معناها ميني سيمتومز، يعني اهم حاجه فيهم الهايبر اكتيفيتي. وبعدين المهمه كمان عشان يبقى السندروم كامل اتنشن ديفيسيت. وبعدين في اذر سيمتوم امبالسيفيتي اجريشن مش عارف كله، يعني المهم ده سندروم فيه ميني سيمتوم. كمان الصفه الثانيه في السندروم ده لازم يكون pervasive، يعني always present، يعني hyper activity always present، ما تبقاش في situation تاني absent. يعني فكلمة pervasive يعني always present. فعشان أنا أشخص سندروم لازم دول الثلاثة يبقوا موجودين، السيمتومز دي كلها يعني تبقى موجودة always present. مش شرط ده يبقى موجود في المنتال retardation، يعني ممكن في situation يبقى active وفي situation ما يبقاش active. برضه بنقول عليها hyper activity لكن ما تبقاش السندروم كله.
So in most of the cases, it occurs in some situations, but not other. But in some cases, it might be pervasive and preclude the diagnosis of this category.
يعني الواحد يبقى حريص كمان في الدياجنوز، يعني ما اقولش عليه سندروم الا اذا كنت لقيت كل البيكشر ومعاه البرفيزفنس، يعني وبعد كده ممكن اقول هايبر اكتيفيتي يعني صح.
The third important category is self-stimulatory and self-injurious behavior, which is more common in severe mental retarded children. For example for the self-stimulatory manieristic movements, body rocking or head rocking, waving of the hands or flapping, teeth grinding. Of examples of self-injurious behavior, self-hitting, biting, and eye poking, head banging.
طب خلينا الاول في الستيريوتايب موفمنتس، يعني انت قلت هيد بانجينج، هيد بانجينج اللي هو كده يعني يقعد يعمل كده، ودي فيري كومن في المنتال ريتاردد. والهاند فلابنج اللي هو كده، هاند فلابنج تبص تلاقيه قاعد طول الوقت بيعمل بايديه كده او يسد، ودي بتحصل طبعا في المنتال ريتاردد وفي البلايند كمان. البلايند يمكن نعرف سببها، لكن البلايند دايما الطفل البلايند يعمل كده، بلايند شايلد. المهم يعني دي ستيريوتايب يعني موفمنتس، وفي ستيريوتايب موفمنتس بالليج ممكن سبايرالز، يعني يقف على التو ويلف كده يعني. سبايرالينج موفمنتس ويقف على التو، يمشي على التوز بس مش ما يمشيش عادي كده، يمشي كده. فيعني دي برضه كل دي ستيريوتايب motor behavior.
The mechanism behind these, actually, it might be a reflection of the poverty of the individual's skills and ability or the lack of stimulation. It might be learned behavior reinforced by its consequences by attention of the caregivers. It might be related to the role of endogenous opioid systems. Some authors suggest that reduction in the perception of self-inflicted pain and euphoria after the increase in production of endogenous opioid stimulated by self-injury.
انت قصدك السيلف انجوريوس behavior.
Yes, this is
على
mechanism.
السيلف انجوريوس behavior الكومن فيها ايه؟ الكومن سيلف انجوريوس behavior.
It might be commonly associated with Leishman syndrome, and Cornelia de Lange syndrome, congenital rubella.
ايوه ايه هم يعني ايش الكومن سيلف انجوريوس behavior؟ يعدي نفسه، يعدي دراعه، وبعدين هيد بانجينج
and eye poking.
او دي الموست سيريس بقى انه جوجينج الاي، يطلع الاي او يجرح الاي، فدي الموست سيريس. وبعدين طيب يبقى ايش دي مهمه ان اعرف النوع، لان ده كل واحده ليها بريفنشن. الهيد بانجينج مثلا بستعمل خوذه يعني.
The incidence varies from 1.7 to 23% in institutionalized population. And the opiate hypothesis, some authors they believe that the role of endogenous opiate system in this might explain the frequency of this self-injurious behavior. That reduction in perception of self-inflicted pain and euphoria after the increment or after the increase in production of endogenous opiate is stimulated by self-injury.
Why?
Self-injury, there is increase in reduction of opiate, internal opioids, and this, yes,
هو يجرح نفسه يصير endogenous
opioid will be released, more release, so he will feel relief, so he will keep on doing the same things.
ليه ما تاخدهاش بمعنى آخر؟ هي سيلف ستيموليشن وخلاص.
Yes, I mentioned that. Yes.
هي مش شرط النظرية المعقدة دي. هو بتحصل حتى في البلايند تشايلد اللي هو نوت انتريتارد. تبص تلاقيه هو كده قاعد هو مع الروكينج موفمنتس بيعمل على عينه كده. فيعني ممكن تلاقيها، ما دي سيلف انجوريوس برضه لانه بيدوس بريسنج الاي يعني. فهي كلها سيلف ستيموليشن يعني العادية بتاعتها.
I mentioned that initially, that's the lack of stimulation. And if we find this, we'll diagnose under the category of stereotype and habit or movement disorder. Then pica, which is ingestion of substance not normally edible, and sometimes also, if in the case of blindness, they can smear the fecal materials. And the fear of lead intoxication is very important in this situation.
lead intoxication وبعدين ممكن أحيانا بياخد الهير بتاعه في ترايكوتيلومانيا، ياخد الهير يعملها بول ويبلعها. فالبول هير بول ممكن تعمل له انساي ابستراكشن، يعني هي انساي ابستراكشن وال ليد بويزنينج الاثنين.
Then learning difficulties and language disorder, it can be a component of mental retardation at the same time, but it might be separate, reach to the range of separate diagnostic entity to have a separate diagnosis of psychotic disorder. Temperamental changes and temper tantrum also common, conduct disorder and adjustment disorder.
temperamental disorders دي عاوزة كلمتين تاني، لأن هو في temper tantrums common.
Yes.
mental retarded على النورمال children. والتانترمز بتاعت المنتال ريتاردد سبيشالي بتبقى ريليتد لفرستريشن، يعني مثلا زي اللي احنا برادر ويلي ده عاوز ياكل كتير يعني.
Yes. So we will
يمنعوه من الاكل يحصل له تمبر تانترم ريليشن لانه منعوه من الاكل. فيعني المهم يعني مور كومن تمبر تانترمز والامبالسيفيتي والاجريشن، سبيشالي مع المايلد mental retardation، الامبالسيف والاجريسيف بيهيفير. ودي ليها فرنسيك سيجنيفيكانس الحقيقه، لان ممكن بعدين في الادوليسنس mental retarded هتلاقي فيه اكسس اجريشن وامبالسيفيتي وكوارلز وفايتس وكده.
Okay, I forgot to mention some important points before diagnosing mental disorder, mental retarded patient. We have to take in consideration many things. That one of them, developmental level of the child, communication skills they have, life experiences and opportunity they experienced, underlying physical disorder in order to diagnose and before diagnosing our psychiatric disorder. And the patients need a minimum verbal fluency IQ at approximately at the range of 50 in order to describe his experience and his emotions. Hence, more emphasis in the diagnosis of psychiatric disorder will be given to the behavioral changes rather than mental, expression of what's with the language, by language or by fluency of the children. Another category, this is the most common category actually captured in the mental retarded. Organic mental disorder can occur also in mental retarded if the children were over.
كل اللي اتقالوا دول functional يعني، لكن دول هركز على organic.
If the children were overactive, impulsive, and had short attention span, or if they had history of seizures, birth trauma, and self-stimulatory and perseverative behaviors. Presence of brain dysfunction by history, physical examination, laboratory test, this is indicator of the organic etiology, and to be etiologically related to behavioral or emotional disorder. As non-retarded children or people, delirium and dementia can occur also, but it's extreme it is common at extremes of life.
ده النورمال يعني كل حياة delirium common طبعا في الاكستريمز اوف لايف يعني في children or old age. فدي بالظبط زي النورمال يعني. المنتال ريتاردد زي النورمال population. لكن هو طبعا الكومن هو اللي احنا قلناه مع المونجوليزم اللي هو الزهايمر ديمنشيا. دي طبعا في كل المونجول الحقيقه اللي بيوصلوا الميدل ايج بيبقى باثولوجيكالي فيه تشينجز وكلينيكال تشينجز بتاع الزهايمر ديمنشيا. فيعني دي اللي تقولها صحيح مع mental retardation.
Schizophrenia and psychotic disorder actually appeared by poverty of thinking delusions, which is less elaborate
دي
in this
لازم
case.
تقول في المايلد الحقيقه، يعني سكيزوفرينيا والحاجات دي تيجي في المايلد mental retardation، لكن الواحد ما يشخصهاش في السيفير mental retardation. في المايلد كمان هي رير، لكن بتيجي في الناس اللي approaching adolescence، وبتبقى السيمتومز بتاع السكيزوفرينيا يعني hallucination يعني البيكتشر اللي انت تعرفها على السكيزوفرينيا صوت
All name now is not used grafted.
لا هي ممكن تقول عليها grafted ingrafted.
But it comes to be actually this is a component of the profound mental retardation rather than separate schizophrenic illness. Organic psychosis has often been used as waste basket diagnosis for any disorganized behavior unclear to the observer in mentally retarded children. Early psychiatrists believed that mannerisms seen in mentally retarded persons were symptoms of psychosis, and they gave the name that proves schizophrenia, which tend to be symptoms or manifestation of the profound or severe mental retardation rather than separate entity.
It's something different.
It is no.
يعني practically speaking ما تحطش diagnosis schizophrenia and mental retardation يعني الكلام ده.
Yeah.
Severe mental retardation.
ما في severe.
Affective disorder, especially
ما هي اسمها كده بروف.
PF prof schizophrenia.
Engrafted أو بروف schizophrenia.
أو grafted schizophrenia. Pardon?
لا ما هي يعني ما حتى ما تتناقش الار ما بتتناقش. هي BF.
Affective disorder, especially depressive disorder, have been underdiagnosed in mentally retarded children. In Author's Clinic, they rated that about 30% of patients have depressive disorder of mentally retarded. And diagnosis depends on behavioral rather than verbalized symptoms. For example, eating and sleeping pattern, weight loss, withdrawal, increased dependency, lethargy, and aggressive outbursts. Two differential diagnoses is very important in case of depressive disorder, mentally retarded. That is the majority of middle-aged persons with Down syndrome, as already mentioned, develop neuropathological changes of primary degenerative dementia of Alzheimer's type. This is one. Another thing is that older retarded persons who are suddenly transferred to a new setting without adequate preparation, we can present with what was called relocation syndrome, that's irritability, withdrawal, depression, confusion, disorientation, which can be understood as symptom of dementia also. Yes, this is, we can say under the new diagnostic criteria and adjustment disorder.
Relocation أنا أول مرة أسمع الاسم ده.
This is a comprehensive text.
يعني طبعا الريلوكيشن بيعمل irritability in anyone.
Yes.
حتى في الناس النورمال adult يعني.
Regarding neurosis, commonly among less severely retarded, and clinical picture is often mixed. Conversion and dissociative disorder may be florid. Personality disorder common among retarded as also non-retarded, and there is a specific.
بس ما تقولش عليها personality disorder الحقيقة، لأن personality disorder ما بنراهاش إلا بعد 18، وإحنا بنشخص mental retardation in those before that age يعني، فما تقولش.
And also I have another slide regarding the personality and behavioral pattern in mental retarded, but there no time.
أقل من 18 بيبقى غلط. وإحنا بنشخص mental retardation في that age يعني.
Sexual problems. No, actually, that's separate slide if you can talk about it.
لا وما هيش important الحقيقة يعني ما تذكرهاش أحسن يعني. ما تذكرهاش يعني أفضل.
This is from Oxford. Sexual problem, public masturbation, childlike curiosity about others people's body may be misinterpreted as disinhibited behavior, risk of pregnancy and production of mentally retarded children. Many kinds of severe mental retardation are not inherited, and those which are inherited are often associated with infertility.
يبقى احنا كده انت خلصت السيكاتري خلاص، فاضل النيورولوجيكال بس قول كلمتين عليه.
اوكي.
هو طبعا كلمتين عشان بقى الموضوع لسه
Neurological abnormality and disorder. There is increased incidence and severity of neurological disorder proportionate to the increase in the severity of mental retardation. However, many severely retarded children have no neurological disorder. If we take cerebral palsy, about 75% of children with cerebral palsy have subnormal intelligence. And as we know, the manifestations might be motor disturbance, sensory disturbance, or incoordination. It might be spasticity or hypotonia or hyperreflexia or abnormal involuntary movement choreoathetosis or ataxia. Sensory disturbances, there some study mentioned that 1/5 of the mentally retarded children living in hospital have having hearing and visual deficit or impairment.
دي انت هتذكرها تحت السنسوري مش كده ولا؟
إيه.
يعني
hearing
السيربرال بولس 3 انواع مش كده؟ involuntary movements والموتور.
No.
اللي هو
If you talk about type, it is different.
والاتاكسيا. اتاكسيا والباراليسيس.
Hemiplegic, diplegic, quadriplegic.
هي دي كلها باراليسيس واتاكسيا.
This is motor.
اتاكسيك تايب وباراليتيك تايب وبعدين الانفولانتري موفمنتس الكوريو اسيتوتيك تايب. دول تحت السيربرال بولس. السنسوري الديفنس والبلايندنس مش كده؟ وبعدين الابيليبسي.
Epilepsy, common among mentally retarded, especially the severely retarded children. 1/3 of severely mentally retarded children had seizure at some time, and 1/5 of the severely mentally retarded children had seizure in the last year before conducting the specific study. Frequently repeated generalized seizures lead to slowly progressive intellectual deterioration. Epilepsy, most commonly when mental retardation is due to cerebral damage, and uncommon when mental retardation is due to chromosomal aberration or abnormalities. All types of epilepsy can occur, but certain rare syndromes occur frequently in association with mental retardation, for example, infantile spasm associated.
infantile spasm دي معروفة اللي بتحصل في الايرلي تشايلد هود ويبقى فيها السلامة تاكس. ودي غالبا بتبقى associated أو complicated بالmental retardation. وفي نوع من البيتيما اللي هو لينوكس جوستورت.
لينوكس جوستورت.
برضه ده بيبقى commonly associated مع المنتال ريتارديشن. بس هو من دول اللي كومن الحقيقة syndromes اللي كومن مع المنتال ريتارديشن.
الانفانتايل spasm they will grow out of it ولا it will continue with them؟
لا السبازم نفسها they discontinued يعني stop. بس بيبقى complicated mental retardation أو mental deterioration.
Cautionary statement in this regard: the younger the child is at the time of investigation, the more caution is indicated in predicting future ability, as the recovery potential of the infantile brain is very good. Also, there's some soft neurological sign.
لا دي مش موجود. المهم ان احنا نعرف الثلاثة دول اللي هو in association neurological in association with mental retardation. السنسوري ديفيسيتس اللي هو blindness و deafness، السريبرال بولسي بانواعه، والابيليبسي. دول الثلاثة ودول كومن الحقيقة الاسوسيشن ده.
Mental retardation syndrome associated with specific behavioral characteristics. In spite of the trained attitude is not to go through these lines, but they.
طب ودي برضه نأجلها لأن دي ممكن تتقري في كتابها وعرفناها يعني يعني كل سندروم من دول في حاجات معينة associated معاها، ودي هتقروها في الكتاب بس عشان الموضوع النهارده طويل وعاوزين آخر يوم النهارده فكلم لنا على الدياجنوز بقى.
Okay, thanks.
شكرا يا Diagnosis of mental retardation.